Usually it starts with a phone call. I mean, Dr. Hines or one of the primary care doctors would call us and say, you know, I have this patient in my office and appears to have pneumonia. I'm concerned about them. Can you take care of them? And we usually meet them in the emergency room for the first time, you know, be it the middle of the day or the middle of the night, and look at the records that they had with Wilmington Health. We can access their computer records directly from the hospital, so we get a good idea of what's been going on before, who they are, what their problems really are, and then we, you know, take care of them in the hospital for pneumonia or stroke or heart attack or what have you. And you know, it's an enormous tool to have the number one physicians that we know well, their primary care doctors, but also that record of their previous care. And then we see them, you know, through the end of the illness and out the hospital and out the hospital door and back to their primary care doctors. We provide continuation of care by first having access to the complete record from the outpatient setting, so we can immediately know comprehensively what that person's problems and care and laboratory tests and x-rays and everything have been in the past. And then when patients are well enough to go home, we can use that same record to kind of give the patient back to their primary care doctor. I think one of the biggest commitments we've made to quality is that we've had this electronic medical record really before many other practices have, kind of having the vision to know that it's going to be really important to collect information to use to measure ourselves, hold ourselves accountable for what kind of quality care patients are getting. I mean, in other words, you really don't know how well you're doing unless you track it and get information about what's happening to your patients, and electronic medical records are essential to that.